This is the Great Healthcare Debate, a no-holds-barred examination of the hottest political and moral issue of 2009, healthcare reform. From your left speaker, progressive talk host Thom Hartmann. From your right speaker, conservative talk host Michael Medved. And now, the Great Healthcare Debate.
And what makes it a great debate is you get to participate. And that was not intended necessarily to rhyme, but it did. You get to participate at 1-800-955-1776, joined by my friend and colleague Thom Hartmann, the most listened to progressive talk show host in the United States. Thom, you're there in Chicago?
I am, Michael. Very pleased to be here with you.
Me too. And I think that one of the reasons we're doing this is because we both believe, and tell me if I'm not speaking accurately for you, that part of what the president said the other night, I was there in Washington, D.C. in the galleries listening to his speech, I agree with fervently, which is that we need civilized, substantive, real debate about how to fix an American problem. And I do think that we have an American problem with our healthcare system. We agree on all that?
Absolutely, Michael, and hopefully we can, in some ways during this hour, provide some of that substantive, illuminating debate that's more light than heat. It's something that just needs to be done. We need to have an honest conversation about these issues rather than slogan throwing and fear throwing.
Amen to that. All right. Let's get into the essence of this right now. There's an editorial today in the Wall Street Journal, which I think it's brilliant. You probably hate it, but the editorial talks about the broken, horrible, nightmarish state of Medicare. Right now, over the next 75 years, we have $37 trillion of unfunded mandate with Medicare. That's just to pay for the medical care for elderly people or people who are going to become elderly. We don't have the money for it. Why do you, Thom Hartmann, believe that we ought to compound this problem by creating obligations for more medical entitlements for more Americans?
I think, Michael, this is a classic example, and the piece in the Wall Street Journal today is a perfect example of the old saying that figures don't lie, but liars can figure. The projections that are put out about both Medicare and Medicaid, and frankly Social Security as well, these systems are all going in the tank. They all assume, A, that the economy is going to continue to be where it is right now, and I think that there's a broad consensus on the left and right that things don't do that. They tend to go in cycles, and I frankly think it's going to get worse for a while, but ultimately it'll get better. And B, that there's going to be no increase in taxes. There's going to be no change. The fact of the matter is that a relatively small change, a very small change, a change that most Americans really pretty much wouldn't notice in their paychecks, would solve all the problems of Medicare. And as to Social Security, if we simply went with the flat tax that Steve Forbes and conservatives are so in love with and said, okay, instead of only people making $100,000 or less paying into Social Security, if everybody paid the same percentage into Social Security, in other words, Bill Gates paid the same amount as the average working person in percentage terms, the same percentage term,
yeah.
That not only would Social Security be solvent forever, but it would generate such a huge surplus that it would overwhelm that projected deficit in Medicare.
Okay, you know that the commission doesn't say so. David Walker, who was the former head of the GAO, the General Accounting Office, and has looked at this, and the commission, which is charged with supervising Medicare, says that even assuming economic recovery,
right, that
Medicare is broke as early as 2017, and that and their talk about,
it depends on how you define broke. That sometime in the next decade or so, they're going to have to figure out a way to add funding.
Get more money.
They're not going to go to zero.
Okay, so let's not talk about Social Security because it's a separate issue. We're talking about medical care here.
Right.
And the reason I'm bringing this up is because, as I take it, your big complaint with President Obama is that you believe that the solution to some of our health care problems is to give every single American the chance to be part of Medicare, right?
Yeah, I actually have written several op-eds on this, and the reason why, there are multiple reasons why. Number one, most Americans know what Medicare is. Number two, most of the problems that we have with Medicare are the result of, over the last 20 years in particular, both Democrats and Republicans drilling holes in Medicare so that for-profit insurance companies can come in and make obscene profits. United Healthcare's William McGuire, who walked away with $1.7 billion, their current CEO, Stephen Hemsley, is sitting on $744,232,000 worth of stock options
pardon me,
just
Thom,
for 5 years.
But you're dodging the basic question. Given the fact that one way or another Medicare is broke right now, I mean, it's
not broke right now, Michael.
No, it's broke
doing
right
just
now
fine.
in terms
They're
of
writing
projections.
checks. Their checks are clearing the bank.
But in 2017, and many of us hope to still be alive then, in 2017, no more wait for the checks to clear the bank unless more money is raised. That's
Sure.
for existing Medicare.
So
you
want
to add people to it.
Exactly. I want to add healthy people to it. Right now, Medicare is dealing with the sickest and most unhealthy among us, Michael. Medicare is available to people who are disabled, which is expensive, and Medicare is available to people over 65, which is pretty much everybody who has, anybody over 65, almost by definition, has a pre-existing condition and is in need of medical care, and is getting closer and closer to the point where it's going to get real expensive. If we brought in all the 20-year-olds and 30-year-olds and 40-year-olds who are not needing medical care right now, who are not expensive, that the health insurance companies want to cherry pick off the top so that they can pay these $100 million a year salaries to their CEOs and have gold-plated fixtures in the bathrooms of their corporate jets. If we brought those people into Medicare, it would make Medicare profitable. And
it would make Medicare profitable?
Yeah, it would actually. There would be a surplus in Medicare right now if you brought all the Americans in who are not using health care and said, by the way, you guys have to pay into Medicare.
Okay, you have to pay into Medicare.
Yep.
How much?
Whatever the Medicare rate is. I frankly, off the top of my head, I don't know what the.
But when you
Medicare
say the Medicare rate, Medicare is largely subsidized. It doesn't cost much for people to pay their share of Medicare because the government pays for most of it.
No,
we
pay for most of it.
Yeah, we pay.
We are the government. We pay the taxes.
Good for you. You're right. So do you want the same kind of arrangement for everybody who's, say, 25 years old, that the taxpayer should pay the bulk of whatever it costs him in insurance?
It's going to cost more. If we had a national health system like Medicare, a national single-payer system, we have in the United States, first of all, let's just establish a couple of realities. We have in the United States a single-payer system, it's called Medicare, and we have socialized medicine. It's called the Veterans Administration. Socialized medicine is where the government owns the hospitals and pays the salaries of the doctors. Single-payer medicine is where the world of doctors and the world of hospitals is a competitive world, and the only area that's not competitive is the middleman who handles the money. And then we've got a third system that we're the only country in the world that has, literally the only country in the world that has, and that is where you have for-profit companies that we call health insurance companies, who are acting as middlemen between you and me and our doctors, hospitals, imaging centers, or whatever. In every other developed country in the world, even in Switzerland, which has no federal program at all, it's entirely insurance companies. In every other developed country in the world, 100% of them, it is a felony, it's a crime, it's against the law for a corporation that is involved in providing basic health care to be a for-profit corporation.
Okay, so basically, and this is one of the problems with where we're going with this, you are very, very far removed from Barack Obama's prescription
You're absolutely
for
right.
healthcare reform.
No, I think, in my opinion, what President Obama is offering right now is not that different from what Richard Nixon was offering in 1974.
You're completely correct, and it's certainly not that different. It's somewhat different, but not that different from what Bill Clinton was offering in 1993.
Yep, you're absolutely right.
Okay. The point about this is, let's focus for just a moment on the Obama plan, not the Hartmann plan, because the Hartmann plan doesn't have a lot of congressional support right now, does it?
Well, it has the entire Progressive Caucus.
Yeah, all 40 of them.
No, it's about 80, but yeah.
All right. Okay, it's still not.
But you're right. It's not going to pass tomorrow. There's too much money being poured down on Congress.
But which
is an area where you and I absolutely agree.
The Obama plan does not call for eliminating these insurance companies. As a matter of fact, the insurance companies are supporting the Obama plan.
That's right. It's going to add new customers for them.
And force those new customers by law to buy that insurance. Why is that that a good idea?
It's not a good idea. I'm opposed to that. In fact, I'm watching United Healthcare's stock and Aetna's stock. Their stocks are all up 2, 3, 4% over the last 30 days.
Okay, so wait, Tom, can we get together then to oppose President Obama on healthcare?
Well, perhaps there's a very real
right.
possibility, Michael. We have to wait and see what the final program is.
That possibility will be developed in the great healthcare debate. Maybe it's Hartmann and Medved versus Obama.
We'll see.
Your calls on the great healthcare debate. Basic question, do we need more government supervision and involvement, or do we need less? That and more coming up.
Government-run healthcare represents monumental change for America. Are you for or against it? Let's get back to Michael Medved and Thom Hartmann as the great healthcare debate continues.
21 minutes after the hour, joined by Thom Hartmann from the left. It's Michael Medved from the right. Tom.
And Shabbat Shalom, Michael. I have a question for you, if I may.
Well, go ahead.
Why would you support a for-profit company being in the middle? Why, Stephen Hemsley, $744 million.
Oh, please, would you stop obsessing with Stephen Hemsley? I mean, Stephen.
He's a symptom. Okay.
Most Americans.
Let's talk about Edward Hanway from Cigna.
Tom,
$28
over
million
85% of Americans, and I know this because I talk to them all the time. You talk to them all the time too. Most Americans, including the 130 million Americans who are currently covered by the government of the United States, including people on Medicare. Most Americans are satisfied with their insurance.
Not
they
most Americans
like
who have used their insurance.
Not true.
And the highest level of satisfaction, Michael, the highest level of satisfaction in the United States is TRICARE.
Okay.
The second highest level of which is socialized medicine.
But
the second highest level is
the point about this is most people
and the third highest is Medicare. Which
most people in the United States do not want to see those companies that deliver their insurance and that provide their medical care being illegal, becoming illegal.
I'm not suggesting they should be illegal.
You were previously.
You never let me finish my sentence.
No. Before the break, Tom, you were talking about how in Switzerland it's illegal, you were holding that up as a model.
It is illegal to operate on a for-profit basis.
The whole idea of outlawing the profit motive in anything, Tom, is anathema to people who believe in a free market system. You get that?
Why? Actually, and I think this is an area where I hope this is an area where you and I agree. Do you want a for-profit military?
We have a for-profit military in the sense that we pay people. And by the way, defense contractors make a profit when they provide M16s. No, it's not a different thing.
I'm not suggesting that hospitals should be owned by the government. I'm not an advocate of socialized medicine, Michael.
So wait. Why do you distrust the profit? Do you think that we should outlaw the profit motive in education?
I think we have with our public schools. Again,
no. We haven't outlawed it. Again, people can go to public schools if they want.
It's the middleman, Michael. It's the middleman. The funding of public schools is not a for-profit operation.
Okay, let me get this straight. And this is
our police departments is not for-profit. They all use things that come from fire.
However, wait. However, if you want to go out there and get a private security company to supplement the police department, you can.
And I think that it should be entirely legal for any company in the United States, as it is in all the developed countries in the world, to provide secondary insurance. If you live in Germany... For profit, absolutely.
Okay, thank you.
If you live in Germany
So we have abandoned...
insurance that covers boob jobs, no problem. If you want to have insurance that even gets you into private hospitals, no problem.
So can we recognize now that we have retreated from this idea that there is something inherently wrong or immoral that should be illegal about profit motive in insurance?
I never said that as an absolute generality. What I'm saying is in primary care, in life and death, Michael, you and I are both parents. You and I both, I'm convinced, I know you well enough to, I think, make this statement categorically. If our children were dying and there was some way to save them, we would do pretty much anything up to and including giving our own lives.
Correct.
If that's the situation, then the people on the other end who are trying to turn that into a financial transaction have us with their hands around our throats in a way that is absolutely not comparable to buying a computer, buying clothes, or buying a car.
Let me tell you something. I prefer in that situation, when I am deadly sick, when my children are deadly sick, I prefer and trust more, not just my own doctor, but the fact that my own doctor is motivated by profit. He wants to earn a living. There's nothing dishonorable about that.
I'm not talking about
There's
doctors.
nothing dishonorable about a hospital trying to be run on a profit basis.
I'm talking about insurance companies.
Or insurance companies.
If the insurance company's goal is to make a profit, that means their goal is to deny your child and mine care.
Are you suggesting that in every case, Blue Cross and Blue Shield, where they are operated as nonprofits, or Group Health here in Seattle, or Kaiser Permanente in California, that they intrinsically operate better?
Yes.
Yes,
I'm quite familiar with Kaiser Permanente, for example. We've had the vice president of him on our show.
Great. My brother goes to Kaiser and uses Kaiser and likes it. I used to.
Nonprofit. I'm a fan of.
Okay, I understand, and so nonprofit can be very good, but for-profit can be very good.
No,
you don't think?
It's absolutely not.
Okay, so what you're saying is all those people who right now are using for-profit insurance companies
are
stupid.
No, they don't.
They don't know.
They don't.
In most
cases, in most states, they don't have options.
You know better than they do.
They don't have an alternative.
Okay, they do
we
almost
offer
everywhere.
Them an alternative. If we simply said anybody in America can buy into Medicare.
Let's go to Bob in Hammond, Indiana. You're on the Great Healthcare Debate with Thom Hartmann and Michael Medved.
Hello, Tom. I've tried to call you a few times on your program, and I just haven't had the luck to get through yet.
Thank you for calling.
Can you hear me?
I hear you just fine.
We hear you fine. Go ahead.
Okay, Tom.
Now we don't hear him so
Now
well.
we don't hear you. Now that you finally got through, we're going to put you on hold. You got to fix that connection.
So much for the cell phone.
Brian, Chicago, you're on the Michael Medved Show with the Great Healthcare Debate with Thom Hartmann.
Hi. Thank you for taking my call. I would like to say, I'm a supporter of President Obama. I think his way represents a nice middle ground between both of your perspectives. That way you have a choice, for a public option, or it might end up being a co-op of some kind. I think that would be good. I agree with Thom Hartmann more that I think if you look around the world and you see there's a lot of other nations that have, higher life expectancies and generally better health care, and people pay less overall, or the country actually pays less for health care. And I think during some of America's greatest times of prosperity, we've had, great government intervention like the GI Bill in the late 40s and 50s and things like that. And during the Clinton era...
Brian, let me tell you why I think the GI Bill was great, aside from the fact that my father was able to go to college and graduate school based on the GI Bill after World War II. The GI Bill was a recognition that you do something to serve your country, you get something in return. It's different from an entitlement. Entitlements are tremendously dangerous because what you're saying to people is, hey, you're breathing, therefore you have a right to another guy's money, other people's money. And that, as Thom Hartmann has fairly acknowledged, is what you're talking about when you're talking about government money. The government doesn't have money. It's taken from taxpayers.
I think we need to discuss this a little
That's a problem
further,
when you're spending your way into oblivion. We'll be right back. Great Healthcare Debate with Thom Hartmann and Michael Medved.
It's the Great Healthcare Debate with Thom Hartmann facing off with Michael Medved. We'll continue right after this quick break. Let's get back to conservative Michael Medved and progressive radio host Thom Hartmann taking your calls and duking it out as the Great Healthcare Debate continues.
34 minutes after the hour, Michael Medved with Thom Hartmann. Tom, we began the last little segment with you asking me a question. Let me ask you a quickie here. The President of the United States on Wednesday night estimated that his health care reform would cost about $900 billion over the next 10 years. Lots of people, including Harvard professor Martin Feldstein, believe it could be double that. Where's the money going to come from? Thom, you there?
Yeah, I am. I'm sorry, Michael. I forgot to turn on the microphone. It always helps.
Oh, good. Yes. Yes. We still have enough money for that.
There
That's
you
right.
go. It's first of all, as President Obama pointed out, if he simply repealed or allowed to expire the Bush tax cuts for the richest, 0.5% of Americans or 5% of Americans, there would be more than enough money to pay for it. Secondly, if he can wind down the wars in Afghanistan and Iraq, you'll have even more.
Well, the calculations don't pencil out in terms of the Bush tax cuts. And by the way, even Henry Waxman, who I met with when I was on Capitol Hill, he acknowledges that repealing the Bush tax cuts on the wealthiest Americans aren't near enough to cover what you're talking about, which is, again, the minimum extra is $900 billion.
Right.
So,
do you think, Michael, that during the Eisenhower administration and during the Nixon administration and during the Johnson administration, when we had a top tax rate on people who were earning more than, in today's money, more than $3 million a year, working class people were paying pretty much what they're paying right now, but very wealthy people were paying between 70 and 90%, all the way up until Ronald Reagan came into office. Do you think during the 40s, 50s, 60s, 70s, and the first 3 years of the 1980s that this country was devastated by those high taxes?
No, because wealthy people dodged them. And they did. The wealthy people paid a smaller percentage. And Thom, you can take this to the bank. Before Reagan, when Reagan lowered the top tax rate from 70% to 28%, and he did, when he did that, the percentage of the income tax burden that was paid by the wealthiest Americans didn't go down, it went up. And that's the truth. Let's go, if we can, to Don in Vancouver, Washington. You're on the Medved Show with the great healthcare debate with Thom Hartmann.
Hi, guys. Mr. Hartmann, do you, if Obama can save all this money from reforming Medicare and the like, what is he waiting for? Why doesn't he do it now? Why didn't he do it 6 months ago?
I am not here to advocate for President Obama's health care plan. I may be someday, but right now we don't have a specific plan.
Getting closer.
Yeah, we're getting closer. But,
I mean, they're supposed to, the Senate Finance
I'm
Committee.
I'm very concerned, for example, that he's suggesting, or that the legislation so far is suggesting, that if you have for-profit corporate insurance and really crummy insurance, like, for example, Walmart provides their employees, that you will not be able to say no to that and buy into a public option. And that's how the legislation is constructed right now, and I think that that's a huge problem. But I do think that if President Obama had wanted to do something and do it well, he should have done it early on. And the area where I think that Michael and I in this conversation are doing important, and I think that this is an important conversation, and this is the conversation that we should be having in America, and this is the conversation that they should have been having in Congress, is that when 8 physicians went before Max Baucus's finance committee, the Democrat Max Baucus, and stood up and said, we want to talk about single payer, Medicare for all, he had them arrested. There was never a discussion about it.
Well, they were doing a little bit of a Joe Wilson action there. They were kind of speaking before they got recognized.
They were, because they were not going to be recognized. And I know that you condemn Joe Wilson, as do I, in his speaking out.
Just because it was rude and inappropriate.
Exactly. And I'm not saying that those people shouldn't have been arrested. In fact, they went in fully knowing that was probably going to be the outcome. But the point is that I think it's a real shame, a real tragedy, frankly, that single payer wasn't part of the conversation.
Well, it can be part of the conversation here, and no one is going to get arrested, not in the great healthcare debate, with your calls. Thom Hartmann from the left, Michael Medved from the right. More of your contributions to the great healthcare debate coming up.
Government-run healthcare represents monumental change for America. Are you for or against it? Let's get back to Michael Medved and Thom Hartmann as the great healthcare debate continues.
44 minutes after the hour on the Michael Medved Show with my colleague and friend Thom Hartmann. Thom, what do you believe is the main issue or dispute that we haven't covered so far on this healthcare issue?
I think the main issue, Michael, is the question that that nobody really is talking about, which is what kind of nation are we going to be? Are we going to be, particularly with regard to healthcare, are we going to be a we society or a me society? Are we going to collectively say, you know, if putting out my house's fire is a we job, if protecting the nation is a we job, then protecting our bodies and our children is a we job. It's something that we should all be doing together.
Is there a right to health care?
I believe so, yeah. I think that the right to life, as specified in the Declaration, which I realize is not a legal document, it's a founding document, but nonetheless, the right to life means just that. And if you are dying and you can't get health care, or you can only get marginal health care, or you're dying because you didn't have health care until you got to the point where you were so sick that you were terminal, then you don't have the right to life.
Does that mean that there is a right, say, to regular dental appointments?
I would include.
You were about to say sure.
Yeah, I would. I absolutely would. Yeah, and here's why. Because if your teeth start rotting out, it can kill you.
Yes, and it can be really, really miserable, and you'll end up looking like someone who grew up in Great Britain.
But even worse than that, it can kill you.
With their socialized medicine, by the way. If socialized medicine is so great, why this? And by the way, it's true. You and I have both spent time in Great Britain.
Yes.
People really do have bad teeth.
That may be a. I haven't noticed that.
If national health is so great,
have you noticed? We've both spent a lot of time in Israel too, which has a socialized medicine program.
Yes, and a very, very effective one. And partially because it's the only country in the world with a doctor's surplus.
And because it has no AMA, which is saying that they're going to limit the number of people who can go to medical school, and you can go to medical school essentially for free.
Well, and it's also because they got tons and tons of doctors who immigrated to Israel from the old Soviet Union because they were eager to escape from
communism, which neither one of us are a fan of.
Oh, amen to that. Let's go to Jason, Taylorville, Illinois. You're on the Medved Show with Hartmann.
Yeah, thanks. Britain's got bad teeth because they don't have fluoride in their water. But I don't agree with either one of you. Your guess makes no sense at all to me. This idea that the rich don't pay their fair share, the rich they don't get any goodies for all the taxes that they pay. So what I propose is to get rid of Medicare, get rid of the military benefits, get rid of Medicaid, and have a single-payer, very primitive medical for everybody. We're as a country, have decided that nobody's going to die on the sidewalk in front of a hospital. So I don't want to have to pay for my broken leg if my neighbor doesn't, just because I can afford it. That's not fair. And the left wants to always talk about fairness. The right makes no sense half the time on this issue. And as far as death panels go, absolutely, I want death panels. I don't want to be paying for some 90-year-old woman to be getting experimental cancer medication, and we have them now. So let's just get one primitive social health care, and then if you want better health care, then you can buy it.
Thom, are you in favor of death panels?
What's a death panel, Michael?
I think what Jason brought up the term.
I think he's being facetious.
I don't think he's being entirely facetious. What he's saying is that at some point or another, you have to understand that medical care is a limited resource.
Sure. And we ration healthcare in the United States. I'm guessing that 5-6 years ago, when the Wall Street Journal did that 7-part award-winning, groundbreaking series that was titled "Healthcare Rationing in the United States," you read it as I did. And, you'll acknowledge that we have healthcare rationing in this country just like every other country does.
But healthcare rationing is being rationed to some extent now.
Based on your wealth.
Yes, it is based on, but also based upon your insurance company. In other words, it is not all from a central authority. That's one of the things that troubles me about Obamacare.
But he's not proposing a central authority.
Well, he is.
Which is what troubles me.
Okay. No, but he is in the sense that he would at the same time offer a public option.
Right.
But it's not a public option for the people who have to pay for it. You don't have an option about whether you pay your income tax or not. You don't have an option of whether you're financing this deficit or not. Do you know that even with the $900 billion that he acknowledges this is going to cost, that's going to cost $300 billion more in interest over 10 years?
The reason why it can't be an option, Michael, is the same reason why we don't have an option, you and I don't have an option of deciding not to pay our part of the fire department. Even though the odds are, God willing, neither one of us will ever need to use the fire department.
No, I agree with you. And if Americans,
Everybody has to
if
participate.
Americans decide that providing medical care for everybody is just like paying for the fire department, yes, then we'll all be obligated to pay our taxes, which is why I'm so eager not to make that definition.
Why?
Because, well,
why would you? Back to my original question. I still don't understand why you would want a for-profit company. I'm fine with for-profit companies making pharmaceuticals, making medical devices.
I trust the idea of profit. You don't. It's really bizarre.
No, I do trust Michael, I've been an entrepreneur for 35 years. I'm all about profit. My program makes a profit. I just don't think that when you're talking about life and death issues, whether it's fire department, police department, military, or healthcare, that the people who handle the money should be making money off the money. I have no problem with the doctors making money, the people who are actually delivering the services, and I have no problem with you and me having, being the people who are paying the money, but to have the middleman make a profit simply by skimming something off the top between the two of us,
it's not skimming something off the top because it's all open and above board. The trust in government bureaucrats to ration health care, to determine who gets what and how things are administered, the trust in bureaucrats to administer something more effectively than people who are looking for profit.
I trust my elected officials before I trust a for-profit corporation.
Wow.
I do.
That's a telling difference, and I couldn't disagree with you more. We will be right back with a great healthcare debate.
Stay tuned, because right after this, the great healthcare debate continues. Let's get back to conservative Michael Medved and progressive radio host Thom Hartmann, taking your calls and duking it out as the great healthcare debate continues.
55 minutes after the hour, and I think we've gotten to the very core of the disagreement, and it's the disagreement between the left and the right on just about everything. Thom, right before the break, you were honest enough to say that you trust government bureaucrats, you trust elected officials and government bureaucrats more than you trust people who are seeking a profit.
When it has to do with issues of life and death, yes, I would, because they are answerable to us. I believe in small d democracy. I believe in this greatest nation on God's green earth, the United States of America. And our founding ideal was that we are the government. And those issues that have to do, I don't want the government making my computers or my blue jeans or my car or any other part. I'm not a communist at all. But when it comes to
what about producing
the death,
what about producing the airplane that you depend on for your life? I just got off the plane from Washington yesterday. But you see, if you trust for-profit companies to build an airplane that your life depends on, this idea that I simply don't trust someone who is in it for profit,
Michael,
I trust profit far more than I trust someone who comes up and says, I want to do you a favor.
Michael, I was, as you know, last year I was in Africa. We were flying around in Sudan, and back in the 80s I was in Uganda and on a for-profit airline, and the plane blew a hydraulic leak and the engine basically exploded as we were flying across Lake Victoria. The problem, of course, was that the airline was trying to make a profit and was not doing maintenance. We have an airline industry in the United States that is heavily regulated, and in the third world is not. And that's why our airliners are safer here in the United States than they are in Uganda.
Well, there are many reasons it's safer in
Uganda. And also, we have an FAA. I mean, are you saying that you don't want to fly anymore because the FAA is government-run?
I am all for regulation of the healthcare industry. And one area where I think you and I can agree is I think it is sinful and should be illegal to drop people from an insurance program because they get sick. And I agree with what the president said the other night. I think we should also have a healthcare system in the United States where you don't go broke just because you get sick.
So why should anybody be making a profit out? Why not have not-for-profit corporations offering health care?
Your obsession is not with people's treatment. Your obsession is somebody else making money.
It's not somebody making money. It's that it all gets distorted by the need to make money, the requirement.
And I don't believe that for a moment. I think that the United States leads the world in medical technology and so many other aspects of healthcare. Rated number 1 by the UN, the World Health Organization.
Number 37.
No, number 1 in responsiveness, which people care about when they're sick. Thom Hartmann, a pleasure exchanging ideas. We're not done, but we're done for now for this hour.
Michael,
thanks for joining us.
Always an honor to be with you, Michael.
Thank you, my friend. Take care. Have a great weekend. Thank you for your participation in the great healthcare debate.
You've been listening to The Great Healthcare Debate, produced with production assistance from WCPT Radio in Chicago, WIND Radio, Chicago, and the Salem Radio Network. Thank you for listening.